that I have this practice of identifying who we can trust. And I know who the trusted countries are. So I know country A, I can trust it on this, but I can't trust it on that. But I know with Cuba, on everything, we are together. I believe that our bilateral relations continue to serve as an excellent model of South-South cooperation and human solidarity in the areas of health training and services, human settlements, technical exchange, science and technology, public works, technical assistance for infrastructure, cooperation on water resource management and water supply, and support of professional services in the fields of basic education. The South Africa-Cuba Health Cooperation Program, the so-called Mandela-Castro Health Cooperation Agreement, is the flagship bilateral cooperation program between South Africa and Cuba. Every year, hundreds of South African young people go to Cuba to study medicine. Last year, 450, not 45, 450 young South African medical students who completed their medical studies in Cuba were deployed in disadvantaged communities across South Africa. At the request of South Africa, 217 Cuban medical practitioners, part of the Cuban Medical Brigade, were deployed throughout our country in 2020 to assist South Africa in combating the COVID-19 pandemic. A year later, South Africa nominated the Cuban Medical Brigade for the 2021 Nobel Peace Prize. Cuba is considered worldwide as one of the leading nations in the treatment of both HIV/AIDS and tuberculosis. And many of its doctors have been on the ground in South Africa treating those exact diseases since 1995. South Africa has learned from Cuba's successes, and we strive to emulate its prevention programs. In June 2015, the World Health Organization recognized Cuba as the first country in the world to eliminate mother-to-child transmission of HIV/AIDS and syphilis as public health problems. Cuba was also one of the first countries in Latin America to roll out HIV prevention and treatment programs and to provide free antiretroviral therapy to all its citizens who were HIV positive. In 2015, 92% of HIV patients in Cuba were receiving dedicated care, and the country had a network of 230 labs testing for the disease. Cuba's HIV/AIDS infection rates are among the lowest in the world due to their health promotion and primary health care support. And the country has even produced 5 generic medicines to combat this disease. This is what I mean by not permitting oppression to make you a prisoner of underdevelopment. When we come to tuberculosis, Cuba has indicated that it aims to be the first country in Latin America to eliminate tuberculosis. This is according to its work plan deposed to the World Health Organization. And it has managed to get cases of tuberculosis down to 6.2 per 100,000, when the rest of our continent stands at 25 cases per 100,000. Cuba has also improved technologies to ensure the rapid and timely diagnosis of tuberculosis. Cuba's 451 community-based polyclinics are the main pillar of its healthcare system, and its healthcare workers are familiar with local problems such as a lack of water and electricity, problems that are also prevalent in our country. So they learn as healthcare workers the lesson of how you provide primary health care in a context where these essentials are missing. To continue, the island of Cuba has more medical staff working in the global south than all of the G7 countries combined. Cuba trains excellent doctors and nurses, which they deploy around the world to places in which they are sorely needed. In 2014, when West Africa was devastated by the Ebola virus, the WHO appealed for urgent medical assistance, and Cuba was the first country to respond and sent 15,000 medical professionals, including 460 doctors and nurses, to West Africa. They were part of the Henry Reeve Brigade, established in 2005 to provide medical emergency support. The irony was that the brigade was set up initially to assist New Orleans in the United States of America to recover from Hurricane Katrina, even though Cuba had been suffering for decades under the US economic embargo. So Cuba showed the United States how to be a humane global citizen. UN Secretary General Ban Ki-moon, talking in 2015, said, "The Cubans are always the first to arrive and the last to leave, and they always remain after the crisis. Cuba has a lot to show the world." I'm talking more about Cuba and its work so that we as Africa get a sense of what we must learn to do. And we can learn it in partnership with Cuba. Cuba established the Latin American Medical School, where students from 123 countries have graduated. Cuba has restored the sight of millions through Operation Miracle in 30 countries at no cost to patients, and has administered millions of vaccinations, a country under a blockade. Despite Cuba's invaluable contribution to health systems globally, its own population still suffers under the sanctions regime and struggles to get affordable medicines for its own people. It is almost impossible to import medicines from the United States. Cuban ships are not permitted in the United States even to get medicines, and they need a license from the US Treasury to import medicine, which is complicated to obtain. The unfairness of denying Cuban children affordable medicines due to antiquated and hypocritical economic blockades, when Cuba has done so much for the developing world in terms of treating and saving their children, is the ultimate inhumane irony. It is not only in the areas of health that Cuba has played an invaluable role, but Cuba, under the leadership of its revolutionary leader Fidel Castro, played a critical role in assisting African liberation movements to throw off the yoke of colonialism and destroy the myth of white invincibility. From Angola to Namibia, Algeria to Guinea-Bissau. It was Cuba that played a decisive role in contributing to the liberation of these African countries from colonial occupation. This has led many to ascertain that Castro was the most genuine revolutionary leader ever in power at the time. In the words of President Castro himself, he said his comrades were fighting the most beautiful cause of mankind. What motivated Cuba was not only its commitment to the liberation of Africans from colonial occupation, and not just his sense, President Castro, of mission. It was the need to fight the United States in the developing world. Because if you've learned history and politics, you know many of the struggles had powerful hands associated with them. By assisting liberation movements, the hope was that we would weaken the influence of the United States on the African continent. One of Cuba's early forays on our continent was when it provided assistance to the Algerian liberation movement against French colonial occupation. In 1961, a Cuban ship docked in Casablanca with weapons for the Algerian revolutionary fighters. And the ship returned to Cuba with Algerian orphans who were to be cared for in Cuba. 2 years later, in 1963, another Cuban ship arrived in Algeria with 55 doctors, nurses, and technicians to defend Algeria from Moroccan aggression. Later that year, 700 Cuban soldiers and 22 tanks were sent to Algeria. Algerians have never forgotten Cuba's selfless solidarity, nor must we. In sub-Saharan Africa, Cuban revolutionaries were sent to the Congo to support the liberation movement and later the anti-Mobutu movement. Che Guevara ultimately pulled Cuban forces out of the Congo, disillusioned by what he called the ill discipline and corruption of some of the opposition forces. Much of Cuba's focus from 1966 was on Guinea-Bissau's liberation struggle, where Cuban doctors and nurses and troops remained until the country's independence in 1974. 90% of the doctors who supported the guerrillas of Guinea-Bissau were Cuban at the time. This intervention was considered Cuba's most successful until Cuba's intervention in Angola in 1975. The deep and special relationship between the liberation movements of Southern Africa and Cuba was cemented on the battlefields of southern Angola, where almost 500,000 Cubans joined their destiny with that of African combatants to reject the military intervention of apartheid South Africa and to fight neo-colonialism on the continent. Ever since, South African and Cubans have been bonded by a noble history of freedom struggle. On the eve of Angola's independence, Cuban forces intervened in support of the People's Movement for the Liberation of Angola, MPLA. Following Angola's independence, the country had a civil war. What led to a protracted conflict was the invasion of South Africa, whose apartheid leaders saw the MPLA as a significant threat, with the real prospect that South Africa could have crushed the MPLA. President Castro once more took a principled decision to send Cuban troops to support the MPLA. Cuba's ultimate success in Angola was precipitated by a major South African attack which forced the MPLA to withdraw to Quito Carnavale, leaving the fighters demoralized. In November 1986, President Castro held an all-night meeting with his closest aides in Havana and decided Cuba would launch an offensive in the southwest to oust South African troops once and for all. The Cuban attack on the South Africans was, according to the head of the South African Task Force for Quito Carnival, a blinding and deafening strike from an enemy that he said is strong and clever. Cuba had been the decisive element in turning the tide of the Angolan War in favor of Angola's liberation movement. The military successes against the South Africans led to the negotiations in London in June 1988 between Angola, Cuba, South Africa, and the United States. Reading the balance of forces, the South Africans gave up, and in December 1988 accepted Cuban demands to abandon Angola and facilitate Namibian independence. So when AfriForum asks why we want to help Cuba, I have given you the answers today. Were it not for the selfless intervention of the Cubans in Southern Africa over the course of 3 decades, it would have taken far longer to liberate the region from racism and colonial oppression. Nelson Mandela understood this, which is why Cuba was the first country outside the continent that he visited upon his release from prison. Throughout the past 7 decades, Cubans have drawn their inspiration from their inspirational revolutionary leaders. Che Guevara said, "The life of a single human being is worth 1,000,000 times more than all the property of the richest man on earth." Cubans are also inspired by the maxim of the 19th century revolutionary Jose Marti, who said, "All of humanity is our homeland." So, comrades, that history defines our relationship as the ANC and the ANC-led government with the people and government of Cuba. Having gone through it, I believe it is now incumbent on progressive forces around the world to ensure that Cuba is liberated from the economic oppression of the United States embargo that it has suffered under since its revolution, so that its people can prosper and live a decent life, as it has attempted very hard to ensure for the rest of humankind. What we should be doing is we should be using all manner of transportation to send people's parcels to Cuba, parcels of solidarity. We should be ensuring that we have petitions that reach the Oval Office every month, signed by millions. No struggle can end without active cooperation between all of us. So, comrades, out of this meeting, let us decide through yourselves what it is we can do in order to reinforce our efforts to provide support in this time of struggle, but most importantly, to work at an active campaign to end the blockade. All our revolutionary sounding talks, including my own, become empty if they are not supported by an active program. So out of this meeting, let us try and strive together to develop an active campaign of support that is practical, that is implementable, that will make a difference. I thank you for listening to me. Amandla! Amandla! Long live the undying spirit of President Nelson Mandela. Long live! Long live the undying spirit of President Fidel Castro. Long live! Long live Cuba. Long live!